Thank you, Bishop Palmer. Our next speaker is Jim Tobin, who is representing all of the Roman Catholic bishops through the Ohio Catholic Conference of Bishops.
Good morning. Good morning. Because of our concern for the poor and the vulnerable, the Catholic Conference is pleased to stand in solidarity with our brothers and sisters in faith here and urging our elected officials to expand Medicaid. In your packet is a copy of a letter we sent last week to all of the House and Senate members. Along with the faith communities here today, we also join with the Ohio Catholic hospitals and the Ohio Catholic charity agencies throughout Ohio and the Ohio Right to Life in advocating and educating for this change. The Catholic bishops of Ohio have consistently insisted that access to decent health care is an affirmation of human dignity and a basic safeguard of human life from conception until natural death. The Medicaid program is not perfect. While we continue to advocate for changes in the overall Medicaid program, such as increases in provider rates and decreases in certain coverages, we support the many life-affirming features of this program. These include Medicaid's preference for the poor, its Hyde Amendment protections of unborn children, and its help, tremendous help, for healthcare providers. Prenatal care is one of the life-affirming features of Medicaid. In addition, our Catholic hospitals, nursing homes, mental health and developmental disability programs effectively and responsibly utilize and depend on Medicaid reimbursement. For example, Medicaid patients account for about 16% of a typical Ohio hospital's admissions, outpatients, and ER visits. Ohio Catholic hospitals provided inpatient care to close to 57,000 program beneficiaries in 2010. In closing, this expansion will increase access and health care coverage to hundreds of thousands of uninsured Ohioans. This will strengthen the health care safety net while adding value to the overall delivery of Ohio's Medicaid services. Thank you.
Our next speaker is Tom Smith from the Ohio Council of Churches.
The Ohio Council of Churches asks all of its members to reach out to their legislators and encourage them to join with Governor Casey and vote to approve the Medicaid expansion. I believe that most of the opposition from conservative voters is because this important improvement in the healthcare arena is connected with President Obama's Affordable Health Care Act. It was the only piece that the U.S. Supreme Court left for individual states to decide individually its adoption. But I honestly believe that from a Christian point of view, it's the most important. Jesus would never have left the least among them to find cures for themselves. In Mark 2, verses 1 through 12, a paralyzed man wants to be healed, but he can't get to Jesus. So 4 friends carried the paralyzed man on a mat to Jesus, and he is cured. Amen. Expanding Medicare is to show compassion to the most vulnerable people. To expand Medicare is to take seriously the biblical model of being a good neighbor. How many low-income Americans with cancer, heart problems, or diabetes will live longer lives because they receive early treatment at a medical home? The U.S. has been one of the very few industrialized countries in the world that has failed to provide health care for all of its citizens. Many of our 18 mainline Christian denominations believe that this expansion is not only a blessing, but also a bargain for all Ohioans. It is not only our opinion, but also that of independent studies by the Urban Institute, Ohio State University, and Regional Economic Modeling Incorporated. Some of the results indicated that expanding Medicaid eligibility would would allow $1.6 billion in state budget savings during the fiscal years 2014 through 2022. With incomes up to $15,415 a year and families of 3 up to $13.75 per hour would be eligible. They also estimate that expanding Medicaid would generate between $2.7 billion and $2.8 billion in state revenue. They have determined that over the 9-year period, Medicaid expansion would create between $1.8 billion and $1.9 billion in net state budget gains. On the more important side, by the final year, Medicaid expansion would reduce the number of uninsured Ohio residents by more than 450,000. It would create 27,000 new jobs. It would reduce health care costs for Ohio employers and residents by $285 million and $1.1 billion respectively. It would even provide a savings for those of us who have insurance. It is believed to provide a savings of at least $1,000 per year in our insurance because of the reduction in hospital emergency. Finally, our council is asking clergy and faith members of all church to join us and the Universal Healthcare Action Network of Ohio to attend an advocacy day on March 20th and visit with our legislators. All of us will speak on behalf of the thousands of families that do not have a medical home with a physician and adequate health care that can diagnose major medical problems at its earliest point. If you or your friends are willing to join us, please access the Ohio Council of Churches website and email us your information to register. The website is www.ohcouncilchs.org.